On.
Good morning. It is October 11th. We're here for our regular scheduled commissioners meeting. We have a full slate of commissioners. We have our administrator, Mr. Gonzalez, and our clerk of the board. At this time, I'll call the meeting to order and ask everyone to please rise and join in the pledge. All right, welcome, everybody. First item on the agenda is the approval of the vouchers. I believe we have one.
Move for approval of fund expenditures in a total amount of $371,736.43 as presented, and note that it has been reviewed and signed by two representatives of the auditor's office and the county administrator.
Second.
There's been a motion and a second. All in favor say aye.
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 Aye. Next on the agenda is the consent agenda, all encompassing one item.
Move for approval of consent agenda, one item as presented.
Second.
Been a motion and a second for the one item on the consent agenda. All in favor say aye.
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 Aye. Takes us down to the presentation by the Exit Conference for Franklin County's Financial and Federal Audit. Jose, please. Good morning.
Good morning. All right, so first off, I do want to take the opportunity here to say thank you for having us at your open public meeting. We're here today to share the results of the county's most recent audit. My name is Jose Garcia. I'm one of the assistant audit managers here on Team Tri-Cities. And joining me today is Debbie O'Leary, who is one of the assistant audit managers on the team as well. Now, before we get started, it's important to note that the presentation we have prepared for you today includes our complete summary of the audit. We also have some supplementary material, and that's the exit packet handout. If you do have a copy of that, we will reference some of those pages, but if not, our presentation should suffice. And with that, let us begin. So we conducted a financial statement audit for the period of January 1, 2022 through December 31st of 2022. And the objective of the financial statement audit is to determine if the county has prepared a complete and accurate set of financial statements and ultimately render an opinion on those financial statements. And we're pleased to report that we are issuing an unmodified opinion, and that means it's a clean audit opinion on the county's financial statements. This is the opinion that you want to receive and provides assurance that the financial statements are fairly stated and materially correct. Additionally, it is important to note that our audits are conducted in accordance with government auditing standards, and those standards do require that in addition to evaluating the information on the financial statements, we also review the county's process it goes through to prepare that information. And in doing so, we're reviewing to see if the county has controls to detect and prevent any material errors. If we did identify any material errors, we would be required to ask the county to make those corrections for the final set of financials. And we're happy to report that we did not have any of those situations. We identified no significant deficiencies in internal controls. There were no deficiencies that resulted in material weaknesses and no instances of noncompliance that related to the financial statements of the county. So overall, for the financial audit, it's a good, clean opinion. In relation to the financial statements, professional standards also require that we share with you if there were any material or any large misstatements during the course of the audit. And we're pleased to report that we did not identify any of those items. We're also required to share with you that whether there were any uncorrected misstatements that remained uncorrected on the final financials, and we have provided a list of the uncorrected misstatements to the county. We do agree with the county that those misstatements are not significant and do not require corrections. They're more of minor items that do not skew the financial statement information. As part of our financial statement audit, we also evaluate certain risks that we'd like to share with you. The first is audit standards do require auditors to evaluate the possibility of management circumventing established internal controls. And if there were any instances that occurred, we're pleased to share with you that in our evaluation, we noted no instances or possibilities where those controls were circumvented. And then a new item for 2022 relates to the implementation of GASB Statement 87. And that statement relates to the county's lease accounting and any relationships that the county has where the county is in a leasee or leaseor capacity. The county is required to evaluate the future activity of those payments and present that information on the financial statements. And so it was one of the areas that we looked at as with any new standards, there's always a possibility of incorrectly calculating that information. And we're happy to report we have no concerns with the county's implementation. We also conducted a federal grant compliance audit, or what's called a single audit for January 1 of 2022 through December 31st of 2022. And the purpose of that audit is to determine whether the county materially complied with the requirements of receiving federal funding. We're pleased to report that we're also issuing an unmodified opinion. This is also a clean audit opinion on the county's compliance with federal grant requirements, and is the opinion that you would like to receive, as it provides assurance that the funds were expended in accordance with the intended purpose and requirements that established by the federal government. Additionally, it is important to note that our audits are conducted in accordance with the uniform guidance, and those standards also require that we gain an understanding of the county's internal controls that it has to ensure federal grant requirements were followed. And should we identify a weakness or concern with that process that could or did result in noncompliance, we are required to share that with you today. And our audit did identify a control deficiency that we consider to be a material weakness. We'll provide additional details in the next couple slides. And then our audit also evaluates for any instances of noncompliance that we are required to share with you, and we noted no instances. In conducting our federal grant audit, auditors are required to select enough federal grant requirements to satisfy the coverage rules by the federal government. This year's audit covered the COVID-19 coronavirus state and fiscal recovery funds, and the county spent about $3.3 million in federal dollars this year, and these costs are about 70% of the county's total federal expenditures. The requirement for the county this year is to at least audit 40% of the federal dollars, and our audit covered met that requirement. Now, as we previously mentioned, our audit did identify concerns during the course of the federal grant audit, and that will be included in our audit report as an audit finding. And we'd like to walk you through those criteria. So the first one relates to suspension and debarment requirement. The county is required to review or verify that a vendor or a contractor is not suspended or debarred before conducting business with the county. And the county can perform that with reviewing the federal database for any excluded parties. The county could also include a clause in their contract stating that the contractor is not suspended or debarred, or the county can request a written certification from the vendor. And during the course of the audit, we found that the county did not follow this requirement. During the course of the audit, we did review those vendors or contracts and verify that none of those vendors were suspended or debarred, and therefore we're not questioning these costs. The second requirement relates to reporting requirements of the Coronavirus Fiscal Recovery Fund. And the county is required to report on a quarterly basis to the federal government on certain key figures of how funds are being spent and how much has been obligated during the period. And during our review in all 4 quarters, the information that was reported did not align with the actual expenditures. And because the county didn't follow this requirement, we are including that as a finding. So our recommendation for the county is that they strengthen the internal controls to ensure all contractors paid with federal funds are verified to ensure they're not suspended or debarred. And we also recommend the county ensure that it is filing accurate reports with the federal government. Is there any questions on any of the information so far?
Questions, commissioners?
Okay. We also noted that the county received a finding over financial statement preparation in the 2021 audit, and part of the 2022 audit is to follow up on the status of that finding. In conducting our audit, we reviewed the error that happened last year, and that related to the county's reporting of unspent federal dollars. Last year, the county misclassified that information on the financials. And this year, we reviewed any unspent ARPA dollars and determined that the item has been corrected. Some additional information we wanted to share with you today is our audit costs that was in our engagement letter. The estimate will align with the actual costs. And your next scheduled audit will be the summer of 2024. We'll cover an accountability audit, a financial statement audit, and a federal programs audit. In your exit packet, you have an estimated cost for next year's audit. After our meeting today, our final report will be published within the next 2 weeks. It will be available to the public on our website. We'll also send the county a copy of that report. And if anyone would like to receive notification of when that report is released, we do provide a link. It is available on our website where anyone can register and receive notification of when those reports are published. And then concluding our audit, we will be sending out an audit survey to the county requesting feedback on our services. If there's anything that we did well, we like to hear that. Also, if there's any areas of improvement, we appreciate that feedback as well. Lastly, I do want to say thank you to the county officials and staff for timely communications throughout the audit process. In particular, we do want to thank the county's auditor office and the county's treasurer's office, as well as their staff who provided more assistance throughout the audit as they carried the bulk of the financial audit work. So we want to say thank you. And our last slides is if there's any questions we can answer today.
Questions, commissioners?
So the only thing that you found was just the control deficiency on the federal funding, is that correct?
Yeah, that's correct.
And do you know if that's been corrected or?
The county did provide a response to that, those errors, and the county's response will be to make sure that they're checking this and with any new vendors that they conduct business with. We've talked with your staff and shared with them how to make some of those corrections on the reporting requirements as well. And so we'll review any of those corrections in our next audit.
All right, thank you.
And then I also want to highlight that while we did have these control deficiencies, they're more procedure-based deficiencies. It did not identify any concerns with how the county spent funds. And that's an important one in the eyes of the federal government.
All right, thank you.
So just want to start by thanking the audit and treasurer's team. You know, we do these audits and comb through a year's worth of work by a dozen people and find one or two things. So I think we should always start by giving them credit for the 98, 99% of things that they get right. And I have no doubt you'd agree with me. You do many audits and you know how much work they do. That said, I am pretty, well, I want to be fair, but I'm concerned about the failure to ensure that vendors haven't been suspended or debarred. It was not many years ago when a former county employee embezzled millions of dollars from the county, and he was able to do that because the county was not verifying the information on vendors. In that particular case, it wasn't about being suspended or debarred. It was about the fact that the vendor simply didn't exist. It was fictitious. And an effort to review for suspension or debarment would have uncovered that, because you can't check the suspension or debarment status of a company that doesn't exist. So I raise this, and again, I want to be fair about it. 98, 99% of what they do is, by your own description, is flawless. But this one is important, because if we aren't checking the status of those vendors, it opens the door for another Houston-style event. So not to overstate it, but it is important, and I appreciate your pointing it out. It gives us an opportunity to tighten things up just a little bit and make sure we don't have another embezzlement. Thanks.
So my comment isn't directed to you, but at Mr. Gonzalez. Being that you're only been here as the administrator for 6 months, all the ARPA people were put into place with previous administrator. Have we got a grip on this now as to checking these vendors?
Chair, I've been talking with the auditor's office kind of about the process. So the report was presented to me probably, 3-4 days ago. So procedurally, obviously it's a concern, as Commissioner Peck said, because of what's happened prior. The fact that there's no misappropriations of funds makes me feel better, but, I'm one that in the reporting element for the folks that are in that process, my plan was, once Jose presented this, take some corrective actions and, make sure that we're doing it correctly, because we still have ARPA funds that need to be spent, and,
Right.
Certainly vendors that we're going to deal with. So I wanted to kind of take a step-by-step approach before we got ahead of ourselves and, let all the facts come out and let you guys weigh in terms of that, and then take the measures that need to be taken. So, but rest assured, they will be taken.
Thank you. And thank you for pointing that out to us, that we weren't checking the vendors. We got into a
Yeah.
big mess before with that happening. Appreciate it. I think that's why we have you as a backup, to make sure we're doing everything right. So thank you, Mr. Garcia, for your presentation. Is there
Thank
any
you.
other questions?
No, just thank you, appreciate it.
Chair, and I would like to just tell Jose Garcia, what a great job and really good to work with. Just really did a fantastic job, and he had a lot of people to talk with, and spent a lot of time with us. So thank you to you and your team.
Thank you. All right. Moves us down to Hub Insurance, County Benefits. Mr. Cleary.
Good morning.
Good morning.
Hello.
Welcome.
Thank you. Appreciate the opportunity to present today's renewal. This is Brandon Cleary with Hub International. We are an employee benefits consultant for Franklin County. To my left is Jamie Carlock, the account support, and who can't be here is Cheryl Hanks, who's our account executive. So we've prepared this presentation and ready to walk through it.
Okay.
Okay, starting with the first slide here, this is the Franklin County Executive Summary for our financial performance of our health plan. What this shows, if you look on the very far left column here, this is our prior plan year, starting from January 22 to December 22. Specifically, how many employees, how many members were enrolled on the plan on the average, and the gross paid claims that were paid out on the health plan versus the premiums that were collected. And then the difference is you get a loss ratio, which is the perspective of how many premiums were collected on the health plan and how many claims were paid out. Last year, oops, I do this every time. Sorry. Sorry about that. You got big fingers. Apologize. There's a 115% loss ratio on the plan for last year. As we met last year at this time, it was at 140%. So what we saw through the course of the trend of last year, as we spiked up in our claims, that we saw that the claims actually trailed down, and that loss ratio improved. Why is that important? It's because carriers, on this bullet point up here, when you're looking about a fully insured carrier, they're looking at a net loss ratio of anywhere between 70 to 80%. This is gross. We'll talk about what net is. And just to remind you, this report includes all claims, enrollment, premiums that are collected, and utilization information on the health plan. When we look at a 12-month window, so that is from June 22 to May 23. Why is that? We're here in October now. It's because the claims are delayed with United Healthcare and reporting. So this is the latest 12-month window. We averaged 211 employees, 393 total members, a little over $2.2 million in claims, and $2.3 million in premium collected. That presented a 95% loss ratio, so that is good. We are stabilizing, continue to trend in the right direction. If you look at the current plan year, which is only representation of 5 months, 209 members, so staying consistent, and 209 employees, 388 members, a little over $1 million paid in claims, and a little over $1 million collected on premiums. 102% loss ratio. So just think of it as for every dollar collected, there was a dollar paid out. Okay? So overall, what does this mean? It means it really presented a more stable environment, so we went out to market this year and shopped our renewal. Any questions on this slide?
Questions?
Okay, let's go to the next one. This is our historical performance. So we're looking at the current, now we're looking at all the way back to 2019. So the top bar graph up here, it shows the perspective of just blue, gross paid claims per year versus net paid claims per year versus premiums collected per employee per year. Obviously, you want to hopefully have less paid claims, net paid claims than premiums collected, which that represented in 2019, and it started to change in 2020. We've looked at this before, but we were with Premier at the time. What I think you really should focus on is pool claimants. Pool claimants are those large shock claims, essentially, for employees. And once they exceed the pooling point of our health plan, those claims are then shifted to the pool and don't count as a net loss to the plan. Back to that slide before, we were concerned about the net loss ratio. 2020, 2021, 2022, really 2021 is when we had the spike, which we've looked at before, over 7 pooled claimants. We paid out $3.2 million in gross paid claims, but there was over 466,000 in pooled claims, which represented 2.8 million in net paid claims. And you go to the far right, this represented our gross loss ratio for each year and what our net loss ratio was once you minus out those pooled claimants. What I want to point out is last year it did stabilize. It was very high when we came into this meeting because we only had data up to May, right? But as the year played out, it tailored down and pooled claimants only were 3 pooled claimants. Currently this year, so far, no pooled claimants. I do expect to have some pooled claimants once we finish out the plan year and have all the data for the year. But the loss ratio is still substantially better than it was last year at this time at 102%. So to summarize again, ultimately it presented a very stable environment for insurance carriers to underwrite, in which allows them to get more competitive with their options and rates.
Before you go,
Yes.
would you articulate pool claimants? I'm not sure that everyone is on
Okay.
clear understanding of what that means and how that impacts our attractiveness to insurance companies.
Yeah, so pooling is there for large claims, essentially large, an individual that's going to exceed or maybe have a very substantial health condition that's to be treated. And, a lot of people think of cancer, emergency hospitalizations, procedures. Well, that individual through the course of the year is having claims paid out. You become a pool claimant when you hit the pooling point, and the pooling point is set on the back of the health plan. And we pay fees for that pool with our health plan and our premiums. That way, we don't absorb all the claims on the plan. Imagine if you had $1 million claimant, right? If you had $1 million claimant, all that would be on the plan, and it would completely distort the loss ratio and make it so that our loss ratio was maybe more above 200%. Well, that pool claim, when it happens, and any claims above that threshold, that claim is then shifted to the pool and does not count in our net loss ratio. And that's the important part, is the net loss ratio. So hopefully that answered the question.
Well, it does, and we've covered this before, so I knew the answer. But the question now that you've explained that is, if you increase the population of people using a plan, let's just say for easy math, you double it, does that double the number of pool claimants you're likely to have?
It would increase the chances.
It would increase the chances, wouldn't it? But nobody really knows whether it might double it, triple it, or maybe not affect it at all. We don't have a way to predict what the claimant activity, I'm avoiding the word burden because, it's a benefit, they're entitled to use it, but the amount of claims, we don't have any way to predict what that's going to look like as we change the nature of people using the insurance and the number of people.
That would be a correct statement.
Okay, thanks.
Okay. So the activity that went on behind the scenes in terms of our benefits committee. So we met 4 times going over through the renewal. Here's the 4 meetings, discussing through the process. Really the committee, we had focus points. Do we make sure that we drove into our discussions and negotiations with the options and our carriers out there? Obviously, competitive medical and dental rates. That was by far a big focus point. Any design improvements that we can improve the medical plan in terms of enhancing coverages or on medical and dental. Provider network access, so access to providers and making sure we have a robust local network. With United Healthcare, there was a few challenges, not a lot, but there was some. Network savings. So when we're going through and we're having these claims, how much of a discount are we seeing on the network? And that helps control claims and the cost of those claims over time. Employee services and support. What other additional services could we get out of the carrier that help support employees and make the experience better? Health and wellness support. So we talked about getting some incentive dollars from the carriers to help with a health and wellness plan and a strategy for next year. technology credits that could help support some of the benefits administration costs that we have here at the county to support the employee benefits. We made an upgrade last year by this board, which I appreciate. It was a huge help, but there's a cost with that. So getting some funds to get the help cover those costs, that's what we're looking for. And then discounts and extra value additions anywhere we can find them for Franklin County. I think it's safe to say that the focus points of the committee, we were able to deliver on those bets. I'm sorry, those focus points, and it shows up in the bid. Okay. Going on to the ancillary renewal. So our ancillary lines of coverage, these are ancillary benefits. With Lincoln Financial, which is the carrier right here, we have our basic life insurance paid for by the county. We have voluntary life insurance that employees elect 100% on their cost. Long-term disability plan, which is the base plan the county pays for. And if employees want to buy up, they have the voluntary long-term disability plan they can buy up in. And then we also have a voluntary short-term disability plan. 3 of those lines, we had 0% increase. Now, we were on a 3-year rate guarantee with Lincoln County. This expired this year. So they have increased the basic life insurance and the long-term disability. The annual cost of that was $1,100 for the life insurance or $1,147 for the long-term disability. We were able to negotiate. Lincoln approached us about an offer, which if we offered 2 new lines of coverage for voluntary benefits, voluntary critical illness and voluntary accident, that they would waive that increase and give us another 2-year rate guarantee. Additionally, while we took that opportunity to negotiate with them, we said, okay, well, can you open up the life insurance for all employees? Meaning like if this was a first-time offering for everybody, meaning you can get to the most guaranteed issued amount without doing a health statement. And they agreed to that. All in all, that is the Lincoln Financial renewal, which we had a committee recommendation to renew with Lincoln Financial and to add voluntary accident and critical illness. Willamette Dental, who's our dental HMO plan, they presented a 2.92% increase, and that's what the renewal will be for this year. For Vision, which we have with the Vision Service Plan VSP, we are still on a rate guarantee, so we have a 0% increase. So for our ancillary renewal, the Benefit Committee's recommendation was to renew with Lincoln Financial, again, adding voluntary accident, critical illness, renewing with Willamette, and also renewing with VSP. Any questions on the ancillary renewal? Okay. Okay, medical and dental. So this is a renewal marketing summary of where we went to market for our medical renewal and for medical and dental. At the top box here is on the medical side with United Healthcare, our fully insured, obviously went out to market for fully insured health plans. But the increase was 20.52% initially with United Healthcare, very high. We did negotiate them down to a 16.6% increase, but that was their final offer. Based off of that, we went to market with the focus points that we just showed earlier. We came back, we went to market to Premera, Cigna, Kaiser Permanente, Aetna, Pacific Source, the Washington County's Insurance Fund, and Assurus. Of that, the most competitive offers we received were from Premera and Cigna, and that was our focus point from that point on. Premera came with a 4.91% increase. That includes some discounts that are offered, which we'll cover here in a bit on the next slide. And then Cigna also came in with a very competitive bid, about 0.22%. And then for dental, we went out to market for dental as well. Right now we're with United Healthcare. United Healthcare came with a rate pass. But we came back from the market shopping for dental. Premera came down to a minus 12% decrease on our dental rates. Cigna minus 2.9%. And then Delta Dental, we went out to and focused on as well, was a minus 6.5% decrease and a minus 3.85% if we went with a 2-year rate guarantee. All being said, we focused on Premera as well for the medical, or for the committee recommendation. Go to the next slide, please. So with Premera, we did receive some value additions to the bid as part of that focus point that we discussed. By going with Premera, if we offered the dental plan with Premera, we received an additional 1% off our medical rates. Received an additional 1% for a wellness program discount off the medical rates. 1% off an early bird renewal, so assuming that we would get our paperwork in time and place, which we have no problem doing, we get another 1% off the medical rates. This will be reflected in the rates we show here next. But also, we got a 1-month APA credit, which is very big. That means that first month premium is not billed, and Franklin County doesn't have to pay their first month premium. That's equivalent to about another 4% off of the rates. So I showed the renewal at 4.9%, but if you factor in that 4%, right, you're really down to about 0.91, so 1% increase. Additionally, by bringing on the dental plan, we were able to negotiate a rate cap. It's not very common, but we were able to negotiate a rate cap with Premera, which for 2025, meaning that they will not increase the medical rates more than 11%. So we have stability, and we can know next year we can start planning around our renewal for next year and the cost increase. As well as they threw in a $10,000 technology credit to help fund for that benefits administration costs that they'll pay for the county. And lastly, most importantly, open enrollment support for employees, realizing this is a change. No change is easy. Doesn't matter if you're going back to something you know. We'll have Premera reps at our employee benefits fair. Members can call with any questions to Premera. We've got an account support team on the backside to verify pharmacy questions, verifying in-network providers, any prior authorizations that are going to need to be transitioned, and transition of care. All in all, the Benefits Committee's recommendation, almost unanimously, was to renew with Premera Blue Cross for medical. Okay. So our health plan. So let's look at the medical. This is our $1,000 copay plan. This is our richest plan on the county. Down here on the bottom, you'll see where it says the monthly rates. That's our employee counts. We have 64 employees enrolled, 11 employees that are employee spouse, 15 employees that are covering their children on coverage, and 3 that have employee family coverage. Currently with United Healthcare, we have a $1,000 individual deductible, $3,000 for family coverage. Coinsurance is at 20%, and the out-of-pocket maximum is $5,000 for an individual or $10,000 for family. Office visit copays under United Healthcare, $35 for primary care and $55 for specialist. There is no virtual care copay, but there is a copay for telehealth depending on what services you go for, primary care or specialty care. The renewal was exactly the same, so it's a like for like, right? That presented the 16.6% increase at the bottom. With Premera, though, we looked at, as we discussed, enhancing the plan design and providing some better benefit, some better coverage, excuse me. The deductibles are going to be the same, $1,000 and $3,000 for family, $1,000 individual, $3,000 for family, 20% coinsurance. The out-of-pocket maximum would be exactly the same at $5,000 individual or $10,000 for family. The office copays, keeping the same for primary care at $35, but specialty care, bringing that office copay down to a $35 copay. So no matter what office visit you're going to see, it's going to be the same copay. Telehealth and virtual care, adding those and getting those into a $10 copay. We do want to encourage virtual care and telehealth more, as specifically it's harder to get into providers quicker and making that more of a convenient benefit for employees. Minor lag and diagnostic x-ray, removing the copay structure and just making that coinsurance at 20%. There's no deductible employees have to meet. It's straight coinsurance right when they receive those services. The other improvements we made as well, it was looking at visitation limits and enhancing those for chiro and massage and physical therapy, 24 for chiro and 45 visits combined for medical and physical therapy, or medical massage and physical therapy. Then we looked at the emergency room copay structure, which currently it's at $150 copay. We went with $150 copay and then making it subject to deductible. Obviously, emergency room is a very expensive place to be treated. We want to make sure employees are going there just for emergency purposes. The prescription drug plan is matched the same with a $500 deductible, waive for generic drugs, So this applies to preferred brand, non-preferred brand, or specialty drugs, your expensive medications, and keeping the copay structure the same on the drugs when it comes to 30-day refills or 90-day refills. All in all, what does that equate to? A 4.67% increase on this plan with Premera. And these are final rates. So they do include the 3% discounts that we discussed, the early bird, the 1% off the dental plan for offering dental, and the 1% for wellness. Thank you. We did look at another option with Premera for option B. That option included looking at a lower prescription drug. All the other coverages are the same. Probably should have prefaced this with the blue is the changes, if you haven't picked up on that yet. But essentially, the prescription drug coverage, looking at it, dropping the deductible to $250 from $500 and increasing the copays, or lowering the copays, not increasing. All in all, though, when we looked at the cost difference between the two changes, just for prescription drug coverage, it was too substantial. So the committee came back with a renewal of option A with Premera. A recommendation. Okay. So the theme is very similar, the same with the $2,000 traditional plan. So copay plan we have. Again, we're matching deductibles at $2,000 for an individual, $6,000 for family, keeping the coinsurance the same, keeping the out-of-pocket limits, maximum limits the same, but improving the copays on specialty drugs, lowering that from $60 to $40. Specialty copay, and then $10 for telehealth and virtual care in terms of that copay. For minor lab, removing the little bit different plan design we had here with United Healthcare, where we had this freestanding benefit where it incentivized you to go to a freestanding facility rather than a hospital-owned facility, removing that completely and just focusing on the coinsurance and waiving the deductible for that benefit. X-ray diagnostic, same thing. Or minor X-ray diagnostic testing, waiving the deductible, you're straight into coinsurance with Premera, and then moving major diagnostic and imaging just to a 20% coinsurance. Visit limits for chiro are improved, and medical massage therapy match the same way. They're going to be 45 visits per year, and then the urgent care, lowering that copay from $50 to a $40 copay if you need to go to urgent care facility. And then consistently, or as we did with the prior plan, the emergency room copay would be $150, and then you just be subject to deductible. Outpatient surgery, which we included the change from last year with United Healthcare doing this freestanding approach for freestanding facilities, getting away from that and just going to 20% coinsurance for outpatient surgery. Keeping the pharmacy plan the same, all in all, this represents a 4.63% increase. And the recommendation is to renew with Premera option A. The only difference is option B is the exact same thing we discussed prior slide, is that pharmacy benefit change, which we decided the committee's recommendation was not to go with that option, to renew with option A. Any questions on this plan? Okay. The medical renewal for the 3,500 copay plan, again, same kind of theme. Essentially, we kept the deductible the same, $3,500 for an individual, $7,000 for family, 20% for coinsurance. The out-of-pocket maximum was $7,000 for an individual, $14,000 for family. Lowering the specialty copay from $65 to $45 on the Premera option, adding the $10 copay for telehealth and virtual care, and then for minor lab and X-ray, moving it from that freestanding benefit that we had moved to last year with United Healthcare to a 20% just coinsurance, waiving the deductible. Major diagnostic imaging, moving it to a 20% coinsurance benefit, and then we talked about the increases on chiro and medical massage therapy for visitation limits. Adding urgent care and get that down to a 45, not adding, but reducing the copay from 50 to 45, and the emergency room changing the copay structure to 150 for a copay and then subject to deductible. And of course, for hospital inpatient surgery, outpatient surgery, inpatient or outpatient surgery, just make it subject to deductible. Matching the prescription drug coverage, That presents a 5.42% increase on this plan for option A. And then for option B, again, we looked at and weighed the differences, and overall, the committee benefit recommendation, or sorry, the benefit committee's recommendation was to renew with option A. Okay. And last is the high deductible health plan. Now, if you look at the enrollment compared to other plans, we don't have very many employees on this plan. Three employee onlys, 1 employee spouse, 0 employee children, and employee family, 0 enrolled, excuse me. The current plan is again, a high deductible health plan with a $3,500 individual deductible, $7,000 deductible for aggregate, 20% coinsurance, and then your out-of-pocket maximum limits are right here. And then again, you have, with the high deductible health plan, you've got to meet your deductible before coinsurance kicks in. Premera's option is here on option A. It matches the exact same plan design, except for the out-of-pocket limit is increased for family coverage, which represents a 4.9% increase. Now, we did, as a committee, look at and discussed about removing this plan. It was the recommendation of the committee to keep the plan in place as an option for employees and to renew with Premera option A. Any questions so far on these 4 plans? Okay. Quickly on the dental renewal. So just comparing United Healthcare into Premera, remember we have a low plan and a high plan in our dental plan. We match the exact same benefits in terms of the annual maximums on both, $2,000 on the high plan, $1,000 on the low plan. Preventive services be covered 100%, 90% for basic, 60% for major, and 50% for ortho, on the high plan. And then matching the same structure on the low plan as well. All in all, the final rates through Premera include a minus 14% reduction on the high plan and a minus 7.31% reduction on the low plan. And the committee's recommendation was to renew with Premera for dental. Any questions on dental? Okay, so for open enrollment, obviously we're here today for the recommendation, to present the recommendations by the committee, and for your review and approval. October 16th, though, we do need to make decisions on specifically who we're selecting for our carrier, the plan selections that we're going forward with, and including employee and employer contributions. Those all build out the back end of the system so that we can be ready for open enrollment by November 1st. And then, of course, we'll have 2 benefits fairs for employees to attend, ask all the questions they need to get asked, as well as after-hours support that we'll be providing, and then conducting enrollments on site as well. And then ideally, we're going to be trying to wrap up open enrollment by the 10th so that we can be ready for our first premium poll, or I should say deductions for our premiums by December 7th for the county. Yep. Well, thank you for the opportunity to present, but open this up for questions on the recommendations that were presented today, or the renewal, or any other questions or concerns you have.
Questions, commissioners?
Can you, excuse me, can you explain the wellness program discount?
Yeah. So, yeah, that's a great question. So when we initially discussed with Premera, they were going to provide a credit, just like a flat fee. So hey, if you use our services, you have 10,000 or 20,000. Eventually, we negotiated 20,000 with them for a credit to use what's called Vivacity, their program. There was some technicalities with it from their perspectives inside. So what they decided to do, instead of giving us the $20,000, here's a 1% off the medical rates, which actually is a better deal than it is just getting the credit. But the idea behind it is ultimately to allow HR and planning that we go throughout the year, working with the committee, to target some health and wellness ideas and provide a bit of a strategy, be it going to preventive care, awareness, walking challenges, just healthy habits and stuff like that we can promote within groups, and use some funds for that to kind of incentivize it. That's the idea.
All right, thank you.
So quick follow-up on that. Did we take the 1% reduction in the premiums, or did we take the equivalent in dollars?
We took it in premiums.
Okay, so
Yeah.
there won't be a pool of money for them to actually pursue those activities. What there will be is a 1% reduction in the cost of the insurance for the employees.
Correct.
Okay. Commissioner Mullen, did you have other questions? I don't want to get ahead of you.
Sorry, go ahead.
All right. So I'm aware over a number of years of going through this process that there's a lot of time and effort that goes into figuring all this out and trying to find the best options for the employees. With that in mind, would you give me sort of a brief insight as to how Hub gets compensated for all this effort that you have to put in?
Yeah, so we have a service agreement, which we go through, and we are paid through commissions on the health plan. And that's done through the deductions through the insurance company to Hub directly.
Sure.
Yes.
Okay. Is your compensation impacted by the number of employees that participate or the dollar value of the plans?
It's the dollar value.
Of the plans?
And then there's certain ones that are based off of per employee per month. Not all of them are all the same, but it is the percentage, commission percentage of the health plan. I'm sorry, percentage of the premiums, excuse me.
Of the premiums,
Yes.
right, which is impacted by the number of participants?
Can be, yes.
Yeah, so
Yes.
more participants, more premiums, more
Correct.
commission for you. Okay. And I'm not saying that that's inherently problematic. I just wanted some transparency as to how it works. I don't think anybody's, that I can recall, has ever asked the question. So I think it's worth knowing.
Yes.
This is really more for Margot, but it is part of this discussion. Can you refresh my memory as to what the total benefits contribution is per employee now and what it would be next year if we adopt this plan today? Does it change?
No, you have two bargaining units that have the. Also, it is 1690.
Okay, so nothing that we're being asked to consider today would change the total compensation for the folks affected by this resolution. The dollars that they receive for their benefits would not go up or down.
Medical choices for the benefit.
For any of what's being addressed in the resolution that you provided to us, I think last night or this morning.
That would change, that's different, yes.
Yeah, so what would the effect of that be? I mean, we've been presented this resolution with the plans that have been briefed, and we've been asked to approve this resolution that says that the commissioners hereby approves the monthly insurance contributions. So I want to be sure if they're being changed, people know what that is. And then it goes on to reference so much for Vision for Life, et cetera. So all I'm trying to do is take a 30,000-foot look and say, if we approve this, the total dollar value for health benefits for each employee affected by this resolution, okay, I realize there are some special groups with bargaining units, but for the folks covered by this resolution, is this going to change their total benefit dollar amount?
I mean, I guess I would say yes, I can't give you like that resolution is separate from the presentation that they are doing now.
Okay, but let me just double check the
Yes.
agenda here.
If I can just separate the two real quick. I think the rates would not change from Primera, which I'm sure you're aware of that.
I got
Yeah,
that part.
yeah.
And if you want, I'll just offer that as a question that I'm going to ask on the next agenda item, so it'll give you some time to think about that or check. So I think our employees are entitled to know if this resolution is going to increase or decrease their benefits, the total dollar value of their benefits. So let me make sure that I've covered these. Just one other question for Hub. You mentioned that the Benefits Committee approved in what was described as, quote, almost unanimous vote. What was it that they approved specifically in an almost unanimous vote?
The carrier choice of going to Primera. So moving, and the plans for all, those were option A.
But nothing to do with the contributions from the county?
No,
Okay.
that was separate from the.
Yeah, and I should have separated those
That's right.
easily or sooner. Thank you.
And the ancillary renewals too, the recommendations we put on there for Lincoln, Willamette, and VSP.
Right, okay, well, I thank you for all your work. I think your involvement is essential for us to be able to do this work, and we couldn't do it without someone advising us, so thank you for that. And that's, I think, all the questions I have for you.
Thank you.
Yeah, thank you very much for your presentation. And it is separated on the agenda. This is just the presentation for the health insurance, and I appreciate, and I don't know why we would have to delay approving of this, because I think all three commissioners are in agreement with this insurance plan. It is definitely better than what we've had. So, do we need to wait till the 16th to approve this?
I would hope we can get an approval to move forward now with the committee's recommendation if,
Right.
with the carrier selections and renewals.
So if that's the case, I'd entertain a motion if there's no more discussion.
Mr. Chairman, discussion. These are separate issues, and there's no way on earth that I'm going to support these medical plans until we've had the secondary discussion, this next item that's on the agenda. Absolutely not. And if it's unclear to anybody why that position is so strong, then you'll find out when we have the discussion on the next insurance item or next agenda item.
So you're going to keep the county employees held hostage on the insurance plan for your benefit of getting $1,690 a month?
Mr. Chairman, I appreciate if you confine your remarks to your own positions and not mine.
Well, this is for the benefit of the employees of the county, and I'm in favor of passing this now.
I see no reason that the interests of the employees or the county are in any way harmed by having the next agenda item discussion before we take any action on this. There's no effective delay.
Commissioner Mullen, do you agree with him?
No, I'm in favor of passing a selection from what the committee has suggested.
Is that a motion?
I'll make the motion that we approve the selection of Primera Healthcare as put forward by the committee.
And I will second. There's been a motion and a second. Discussion.
Mr. Chairman, I see no way that this board can authorize this plan with the distribution of payments as presented in this resolution that's coming up without knowing what those contributions are going to be. We don't know if the total contribution amount is going up or down. We don't know how those are going to be distributed. And if you approve these providers and these plans, then you influence the second discussion, I believe, on Resolution 278. But we're going to have the Resolution 278 discussion, and if it becomes problematic, then the people who vote for this now can own that decision then.
That is a separate item, and it's next on the agenda. There has been a motion and a second for the approval of Primera as our health provider through the advice of the committee that reviewed it. All in favor, say aye.
Aye.
Aye. All opposed?
I will abstain on the basis that the decision and the motion are premature until we've addressed Resolution 278.
So I'll go ahead on the insurance plan. Thank you very much for that work. And now we'll move on to Resolution 2023-278, benefit contribution changes for non-bargaining employees and elected officials, presented by Mr. Gonzalez.
Thank you, Chair. Appreciate the opportunity to speak. Thank you, Brandon and Jamie. Been really incredible to work with. The hub has been great, so thank you both for the hard work. I know it's not easy. Bringing in Margot and Tim Anderson, our CFO, to kind of explain, and what I've been tasked to do is to work with Margot and Tim on the contribution side. So we've investigated and looked at 17 other counties across eastern Washington to sort of compare and contrast what they're doing, and working with Tim specifically on the financials. So before they present, I would like to, and hopefully Austin can help me out, I put together a PowerPoint with just some bullet points and a few things. And I think, can I plug it in from here, Austin? Yeah. Let's see if you're probably more technologically savvy than I am. So we got that part. Let's see if I can do slideshow. So this is a bit of a explanation of our benefits package and sort of how some of the contributions are laid out. Current benefits costs to the county in total are $4.6 million. So our VEBA distribution is right around $2.7 million for the total cost. So that $4.6 million is a combined cost between VEBA and what we pay for our premiums. So we actually pay more in VEBA distribution than we do in our medical costs. So, I've been fielding a lot of calls and emails from employees. Certainly I'm empathetic. Everybody has a different situation. Fully acknowledge that. And, the people are asking why we're trying to do this. And when I look around at other jurisdictions and how the money's being distributed, the current system, I think this is the most important point for people to realize. Current system is just not financially sustainable over the long run. VEBA is not a benefit. VEBA is a benefit. It's not a requirement that we provided. And as you'll see, different jurisdictions lay it out much differently in terms of the way they distribute it and the amounts. I think when I look at the big picture, there might be pain points at the beginning, but I think ultimately our benefits package, Premera, is a much better benefit plan. And once we distribute it, what I think more equitably and fairly, it's going to be a more attractive plan overall. As I mentioned, we apply more money towards VEBA than to our premium. I'm never going to tee this thing up as this is going to be a savings to the county. We don't know. I mean, more people may jump on our plan because it is a better plan. It's more fair, and there's equity across the board. There's so many unknowns and variables in healthcare insurance, and people get sick. We just simply don't know the factors. But what I do think is the hub and what Tim financially and Margot have looked at, I think overall we will have a better, more equitable plan. Here's some of the things when I investigated this and looked at how the numbers break out. Currently we have 59 employees who waive insurance at an average of $1,590. That costs the county $1,125,000, and certainly these numbers are rounded, so they're not exact. We have 126 employee onlys at an average of around $900 a month. That costs us, $1.3 million. We don't have as many employees on employee spouse, and that's around $250 a person per month, at a cost of about $81,000 per month. And you guys can read the numbers. The employee and family receive $0, and in some cases, employee spouse on the $1,000 deductible plan receives $0 either. And I've received some feedback that perhaps this is a punishment to the other, employee onlys. This is not a punishment if we reinstitute and it's approved by the commission. I mean, it's simply when you look at these numbers, I mean, it's not sustainable. It just truly isn't. When you pay out 2.7 in VEBA, and again, you have to recognize VEBA is not a right. It's something that we're generous and we offer as part of the overages. So certainly that can be used in other capacities. So I wanted to look at some other counties to give perspectives across the state of Washington. So HR sent out to just about every county in eastern Washington and several in western Washington. We received 17 responses. So again, I think this will give you a good outlay of how other counties are distributing their cost outlays, their contributions, and ultimately the overages to VEBA. So Benton County, our neighbors, you see 300 for non-BARGs, by-county employees, 250. No VEBA for corrections, lieutenants, corrections supervisors, corporals, or sergeants. Courthouse, $80 of base wage. Sheriff deputy, $100. Chelan, the road crew is $200 monthly. You see what non-BARGs get. The jail staff, around $200. $50 for sheriff. Yakima, $123.51 to employees enrolled as employees only in a specific health care plan. Mason County is offered only to retirees. Clark County, VEBA is not offered. Snohomish, $200 monthly sick leave cash out at time of separation. Pacific County, $105.96 monthly. FOP, $225.96. Employees who waive get $535.39. Island County, $250 to those that waive medical. Guild Criminal Division, $100. Corrections, $275 and $175 to those that waive insurance. Okanagan County varies by union, ranges from $25 to $95. Garfield County, $100 monthly, $600 monthly for employees who waive. Adams County, $76.23, $194 if you have the high deductible plan. Douglas, bargaining groups, $125 a month. Excluded employees received up to $308 unless they purchase insurance for dependents, then it drops to $125 and the difference is applied to the premium. Spokane County, VEBA is set up for post-separation only. Skamania, $60 per month per guild, non-guild, and sheriff's office. Walla Walla County, and this came in, thank you, Michael Killian. He pointed this out, $1,500 contribution per month for medical insurance, and if employee selects the $5,000 deductible, and along with the dental, vision, et cetera, only costs then $800, they put the rest towards VEBA. Kitsap, they really break it out. I'm not going to go through this line for line, but I'll give you the opportunity to take a look at it for a minute. So it really varies depending on what union you're with. Lewis County, and this is the final county, sheriff's deputy, $75 contribution. Sheriff's operations, sergeants, $50. And here's our current medical plan, as it breaks out. And you can see the contribution amounts or the rates on the left and what we contribute. And currently, I want the public to know this, we currently contribute across the board $1,568.25 to each employee. And you do basic math, and I'm doing this for the public. Each plan costs a different amount. So the way we do it here is in an employee only in the $1,000 deductible range, you basically do math. You do 1,568, 25 minus the 764, and that's where you come up with the 803 VEBA contribution. So just from a transparency standpoint, I wanted to present this information as the facts and then let you guys take it from here.
Thank you, Mr. Gonzalez. That's very well done. Something I asked for many years ago, my first term. And you can see that we are setting a precedence for the state of Washington in Franklin County. And I want everybody to know that if they're receiving VEBA, they have an insurance plan that's better than ours. Nobody's been denied insurance. Everybody has insurance. That is the benefit that we're looking for everybody to get. They have insurance, but we're setting a precedence by the amount of money that we're distributing and it's costing the taxpayers a lot of money. So with that, I'll open it up for discussion.
Margot, I'd like to come back to you with my earlier question, if I could. The total contribution for healthcare benefit dollars for each employee, excepting those couple of bargaining units that have a separate arrangement, is it the 1690 mentioned earlier? Is it the 1568 Mr. Gonzalez just said? Can you tell me what that number is?
Overall, it's the 1690. The 1568 is medical only. The rest of it goes a portion to dental, vision, life insurance, and long-term disability.
Okay, thank you. That's helpful. Is every employee entitled to that 1690.06?
That currently receive it, yes, with
Okay.
the exception of those bargaining units.
Okay. This resolution that is before us next on the agenda, do you see that in any way impacts the current situation? And by that I mean each employee, as you just said, gets 1690.06. Would this resolution change that such that some people might not get the same as others in terms of total benefit dollars? Let's set aside for a moment how the dollars are spent.
Well, it would change it. It would basically just reallocate that money, and where everybody would, or most people would get equal, would be moving it to the VEBA amount. So instead of the 1568 going per person to that plan, we would adjust those, which is on this resolution, would be the employer premium paid.
Right.
That's basically where that money would go, with the rest going, or the others going to VEBA.
So the 1690, which is all the benefits total, currently each employee gets the same amount and has a variety of ways in which they can take those dollars. This new plan, as I read it, would move some of those dollars from employee A to employee B or C or D. So the amount of dollars you would get for your health benefits would change based on how you elect to take them. Is that accurate? Could change depending on how you,
It is accurate, because it would change, yes,
Right.
that is true.
right?
Where the current version, yes, you would have 1568, you basically just pick whatever plan, just whatever's left over rolls into VEBA. This new version, you still pick your plan, and as to what that cost may be, but you get money in VEBA regardless of what your situation is for employee only down to family. So yes, it changes, but the employees would still get an equal portion of the share, if you will. It just is going into the VEBA, where the other money is getting distributed out.
So I would ask you to explain how it is that each employee is still going to get an equal amount, because as I have studied these plans, it's quite evident to me that while an employee only gets an insurance plan and a family over here gets a plan, it certainly appears that the cost of the family plan has been bought down by shifting dollars from the employee-only side and from some of the other categories. I'll be the first to acknowledge that this is not unique to this plan. Other counties do this. I have always been of the impression in the position that these are human benefits. They're not predicated on the job you do or how long you've been here, or how many people you supervise. And each human being, in my view, employed by the county ought to be treated equally and be given as much flexibility as possible in how they choose to spend their allotment of dollars, which should be identical to everybody else. If for no other reason, then none of us, as Mr. Cleary acknowledged earlier, none of us know what individuals' health needs are. In my conversation with him, it was predicated on if we bring additional people into the pool, how would that affect the costs, and do we know what that would be, and would it create more pool claims? And he acknowledged, I think correctly, that we don't know. And the point of that is that we don't know what individuals' benefit needs are. Just because someone takes the employee only doesn't mean that they don't have a family. Doesn't mean they don't have other people. It means, typically, in my experience of 15 years of going through these plans, that they are looking at their situation, and oftentimes they're combining their plan here with a spouse's plan together with VEBA dollars, and what they're doing is maximizing the benefit to their family need. So to make the assumption that an individual employee has a lesser health benefits need can in fact be exactly the opposite. It may in fact be that they have a greater need. We simply don't know, as Mr. Cleary pointed out. This is why I think it's so essential that we're honest about the fact that these are human benefits for each employee. And because we don't know what their individual needs are, we should not be socializing this process with a redistribution of wealth between various employees when we don't know what those individual employees' needs are. And we're predicating these decisions based on things like marital status, presumption of need, some cases veteran status. I think some of these are legally problematic as well in terms of the county's discrimination based on various classes. I'm going to pause there. I've got other comments and questions, but I'm mindful that my fellow commissioners have questions as well.
So would you say that us, Franklin County and Walla Walla County, are the exception, and that most counties do not pay out the VEBA like we do?
Yes, by the research that we were able to get, I would very much agree we're the exception.
And which individuals have the opportunity to turn that VEBA into cash?
That's select groups, and it's done by the groups that go for VEBA. Currently, the elected officials, the appraisers, and the sheriff support all have made a selection with VEBA to have their VEBA turned into cash, or at least a portion of it.
In my experience, when I've worked for an employer that had insurance, it was either you take it or you don't. So I guess my question is, how did we get in this situation to where we're paying people cash not to take their health benefits?
To fully answer that would probably take a little bit more research on my part. Unfortunately, I do know that the county can basically choose what the groups are that go to VEBA, and it's pretty much union groups is what it is. Like all the non-bargs are in one. And then there has to be a majority vote by those groups of whether they want to receive that in cash versus just in their VEBA account, but there might be more to that I don't have the answer for. So that's a very general explanation from what I've gathered so far.
So in comparison, it seems like we're always comparing ourselves with Benton County. How does our VEBA payout compare to theirs?
If I remember right, they receive $300 that goes into their VEBA account. Whether they have anybody who receives it in cash, I don't have that knowledge. I don't know.
All right, thank you.
So I have a question. Under the new plan, will any of the VEBA money be able to be turned into cash, salary, or will it only go to VEBA?
For this resolution,
Yes.
turning it to cash is not going to change. Those groups made an election, and they would have to reverse that choice for it to be maintained just in VEBA. And if memory serves, I believe the option that was picked, I believe by the elected officials, I'm not sure about the appraisers, there were two options. One was to go into cash, and another was for it to go into a deferred comp plan. So there is an additional option for at least the elected officials. I'm not sure on appraisers. I'd have to look into that.
Thank you.
So Margaret, I'd like to start by following up on that last question. There's still the opportunity to take those health benefit dollars as taxable fringe benefit, but the dollar amount under this resolution appears to be reduced significantly for those groups that opt to take it that way. Do you agree with that assessment?
Yes.
Okay. So the reality is that all employees have the option to take VEBA dollars as a taxable fringe benefit if their groups or a majority of their group votes to do it, correct?
Is my current understanding. There's
Right.
more to that I would have to find out.
So my view is we're not discriminating against any employees. Anyone who wants to do that can go to their group and they can vote as a group to make that election the way the 3 or 4 groups that you mentioned already have. The current process gives exactly the same number of dollars to every employee, which I still contend is the most fair and most equitable and most ethical way to do this. The cost to the county is exactly the same whether a person takes it as a taxable fringe benefit, takes it as VEBA, takes it as insurance, or takes some combination of those. It has been articulated 2 or 3 times here that Franklin County is somehow an outlier among the other counties. And I find that interesting because so often I hear people in this room talk about how we shouldn't follow the pack and we should go sue the governor on this and that, and we should be leaders and we should not be afraid to do things that are outside the norm, as long as we can articulate why it's in the best interest. So the cost is the same under the current system. The employees have a choice of taking whatever combination they want. It seems to me that when it comes to attracting and retaining the best employees that we can find, this is a time in this critical labor market where we want to be an outlier. We want to offer the flexibility and the compensation through benefits for our employees that causes them to come work here instead of in Benton County or some other county where they don't have as much flexibility in their benefit dollars. I think that's one of the chief reasons why the system we have now is the most fair and the most valuable. I find it interesting that we don't have, in some people's opinions, it sounds from their comments in this meeting, that we don't have the ability to sustain this kind of compensation, yet when you consider that we have $5,000 to throw at every single employee for a retention bonus, I would argue that dollars are better spent for these kinds of healthcare benefits and flexibility in those benefits as a better way to attract and retain employees than throwing retention bonuses to people who, frankly, many of whom had no intention of leaving. It's been described as this new resolution as a better plan, a more fair plan, a more equitable plan, and that it's not a punishment. I couldn't disagree more. You are punishing some employees by making judgments about their medical needs about which you have no insight or knowledge, and I don't mean you personally, just anyone who would do it, because you don't know what their needs are. You're making assumptions based on their category of employment or the category of benefits that they're forced to take, that somehow they have less need. And so you're going to take some of the dollars that normally flow to them, and you're going to move it to somebody that you perceive, maybe a family or an employee with a dependent, that you perceive, that you guess, that you think has a greater need, without even understanding, as Mr. Cleary pointed out, that some of those people you may be arm twisting into the plan may be those pool, high-risk, high-dollar employees who aren't in the program now because they're marrying up their employee only together with VEBA, together with a spouse plan. The last set of comments that I've got, I will read through as quickly as I can. I wrote these down so as to make sure that I got the language correct. So in summary, health benefits are human benefits. No employee should have a portion of their human health benefit dollars taken away from them and given to another employee on the premise that another employee has a greater need. We don't know what the individual needs of our employees are. We don't know the health needs of each and every one of them, their families, and their marital status is not an appropriate discriminator. We don't know what other insurance they may have. We don't and shouldn't know what their health challenges are that they face. This approach is quite simply a socialist redistribution of wealth among employees. 2, every employee should receive exactly the same dollar amount for their health benefits. This action would change that. It would take from one to give to another on an unfair premise. The county should provide as many options as possible for our benefits as we do in the current system, which attracts employees who could go elsewhere, and I predict many will. If the goal is to reduce costs and reduce the benefit amount equally, valuing each and every employee equally in this regard. The majority of this board and the county auditor have repeatedly asserted that employees receiving some or all of their health benefit dollars as a taxable fringe benefit is equivalent to a salary or compensation increase. In fact, our auditor has sat right in this room and said that it was unconstitutional for that to happen. Well, I submit that if those statements made by members of this board and the auditor, if they are correct, that this is salary, then the action before us here today is illegal on the simple premise that it reduces the income of elected officials in the middle of their elected terms of office, which I say again is unlawful. You can't tell a judge or any other elected, we don't like the way you're doing your job. Judge, we didn't like that last ruling. That pay increase you were going to get, not going to happen. In fact, we think we should reduce your pay. You can't do that to electeds in the middle of a term, and this has that effect. So I think you can expect a legal challenge on that basis. Some veterans receiving health care benefits are potentially disadvantaged and discriminated against by these health care proposals under SSI and Medicare rules. For some of those people, veterans, VEBA dollars can be first payer, meaning that the government will tap those dollars before their health care benefits under veterans' terms kick in. And lastly, equal treatment and flexible use of benefit dollars helps attract quality employees. It reducing the flexibility of those benefits and redistributing those benefits on a discriminatory non-merit basis, marital status and other perceived need, will not help us attract and retain quality employees. I didn't take the time, I didn't think it should be necessary to point out that there are other PERS, state entities and agencies that give every single employee exactly the same dollar amount. They give them a long list of options and services and benefits and insurance plans they can choose from. And at the end of the day, whatever they choose to purchase off that list, they can with those health care dollars. And anything that's left, they receive as a taxable fringe benefit, and it's not income. Thanks.
Chair, permission to speak.
Mr.
I did
Gonzalez.
want to bring up Daniel Stovern because I had a conversation with him and yesterday about this issue, and currently the position his office takes is that it is a fringe benefit, but right now it's in the AG's hands in terms of what ultimately that decision will be made. But I want to give the opportunity for Daniel to weigh in and give his perspective, or at least the office's perspective anyhow.
And if I might add, before Daniel gets up there, that is, if Mr. Peck is correct in his assumption there, then I guess he's going to be paying back over $50,000. Go ahead.
Mr. Chair, you spoke to my position, so I'm going to take the floor.
No, Commissioner
Mr.
Peck.
Chair.
Commissioner Peck, you
It's
spoke to
point of
my
order.
position, and I didn't, there is no point of order.
There is a point of order.
Give me your point of order.
Point of order is the chair spoke to my position and my circumstances. I did not speak to yours, and therefore I have the right to respond.
Chair will not recognize the point of order. Go ahead, Mr. Stoper.
Commissioner, I think it might be appropriate to take a break and go into executive session about this issue for potential litigation
Right.
issues at this time.
I think we need to keep this out and open and transparent to the public. These are their tax dollars, and this abuse to our benefits package is one on way too long. It was voted in by the previous set of commissioners, previous to me and Mr. Mullen. This is something that no other county is doing, and
Chairman.
what we have to speak of.
Chair is
we
out of
spoke
order.
In public.
As long as the board or a majority of the board acknowledges that they might be receiving legal advice and any kind of confidentiality you would normally expect.
I'd like
with
to
your
ask you,
attorney.
Mr. Where is Sean Sant? Shouldn't he be here addressing this?
Mr. Sand is currently deployed with the U.S. Army.
Oh, he's not in the courthouse? He never gave anybody notice. I didn't know he was gone.
He told me he'd be gone until, I believe it was at the middle of December, but
Okay.
I don't know
I
if that's
I would
correct or
agree
not.
with Mr. Stover, Commissioner, if we just have 5 minutes in a brief executive session to discuss some new facts regarding this issue.
Okay. So at this time, Mr. Gonzalez, I guess you'll take us into executive session underneath the RCW?
Yeah, under potential litigation.
4230, 110,
Okay.
I, triple I.
Okay, well,
5 minutes?
we'll go with that. Yes, let's say 10 minutes.
10
just-
minutes?
Just to give it some breathing
Okay.
room.
I'm not coming in for it. I'm staying on vacation.
Okay, we're out of executive session. We're back to regular session. And at this time, I'm asking the commissioners that we should table this until next week because there's information that we need to gather.
I would second that.
It's just a consensus.
Yeah.
Mr. Chair, I would go a step further and say that I think we ought to request that our legal staff retain expert counsel on this matter. This requires approval of the prosecutor's office, but there are complexities in tax law and trust law that I think are certainly far beyond me, and I think that our legal counsel in the prosecutor's office would also acknowledge that this is not their area of expertise. It's an important issue. We need to get it right, and I really think for the interest of everyone concerned, we ought to entertain getting that outside counsel.
So Jeff, if you wouldn't mind. Do you have anybody in mind that you would?
I don't, but we could see if we could find someone that would get on board. Our office, certainly, to Commissioner Peck's comments, we're not experts on tax law or trusts, so we certainly could benefit from some counsel that specializes in that area.
Do you have anybody in mind?
Right. It would be, it would be the elected prosecutor's call whether or not he feels like our office could take that on, so.
So we're 3 months out on getting a ruling on this?
No, Commissioner, Mr. Sant is in contact
Oh, okay.
daily.
Okay, alrighty. Okay, so at this time, we'll just table it until we can hear back from our PA. Takes us down to oh, go ahead.
I'm sorry, if I could speak really quickly.
Absolutely, Barbara.
Just for a timing purpose with Hub and our Ben admin system and open enrollment, if this is gonna be tabled, then, I mean, that's great. We need to move forward with current.
We already
them
voted
so
on
they
it.
can go, well, I'm just saying that timing-wise, we will just move forward with them, so we're not holding
Yes.
them up for anything. Okay.
Yes, and we
Perfect.
voted that.
Yeah, that. If this resolution would have passed, right, we would have had all of the contribution thing given to them. They can build out the system so we can get open enrollment going in a timely manner, because we are really constrained by how we pull our benefits, and we have to have it all done by that first payroll in December. So with tabling this, what we do is we just maintain status quo, if you will, and we can still get them that information. So I just want to make sure that we're all on the same page for timing-wise and what it looks like, so we can make sure all our employees get open enrollment.
So at our next meeting, if we have a decision on this, we won't be delayed at all, really, with the, we'll be fine.
You would be okay with that one, but if it was after that? Okay.
Okay. All right. Well, I appreciate that. Thank you. So thank you.
Yeah, thank you.
So with that, we'll move down to public comment. If there's anybody for public comment. Anybody on the phone? Nobody on the phone?
Hi, I just want to comment on the presentation that Mr. Gonzalez gave. I just want to also, I just want to note that he did not include the spreadsheet of what he is offering to show to the public. That was left out of that presentation, and that is very significant into this proposal.
Thank you. Anybody else for public comment?
Good morning, Commissioners.
Good morning.
I wanted to say thank you for representing us, and Mike, you as well. Sometimes there's tough issues to wrestle, and you guys are wrestling them, and wanted to say thank you for that, to all of you, for doing that hard work. Wanted to bring to your attention something that happened at last night's City Council meeting, and would encourage you to go review that video. So this is a continued pattern that the City of Pasco staff has been doing for quite some time. And that pattern is for the staff to decide that there's an issue that needs to be addressed and to come up with a solution, and to do that without the stakeholders. And I'm sure at some point this will impact the county. What that topic was last night that needs to be addressed is the staff proposed last night to increase the cost of water rights to go to single-family housing, multifamily housing by an astronomical amount. I can't quote it all to you because I couldn't be there last night, but I've begun to review that. And as one example, the current cost when you develop land into housing, if you don't have the water rights to bring into, to hand to the city to do that, and if you purchase that, currently that number is just over $1,700 per acre foot. And while I recognize that that is below the market rate, their proposal is to go from a little over $1,700 up to more than $6,200 to increase that rate. And those rates go across, and they describe it as, to put it together, as a surcharge, and anyways, I'll just encourage you to review that. It would increase the hookup charge for a single-family house from a little over $500 to more than $1,800 per each. And when we have a time in our community where low-income housing is a real issue, one of the city department directors, I was recently in a meeting, and he stated that we're more than 24,000 units short in our area to be adequate for housing. And so anyways, would encourage you to review that, and would also encourage the county not to do what the city has a growing pattern of, and that is to make a decision internally with staff and without reaching out to the stakeholders, take it to city council for a workshop, and then shortly thereafter to try to convince the staff to pass the resolution that the staff has proposed without reaching out to the stakeholders on that. So would encourage you to do that. Thank you.
Thank you. Anybody else for public comment? Nobody on the phone?
Kathy Sant, Franklin County. I just have a suggestion that we could move the public comment period, the first one, after the consent agenda, so people would have a chance to make their views known before you guys vote on certain things on the agenda. So that is just my suggestion. I don't know. If I remember previously, I thought it was earlier, and now it just seems like we have the two public comments just kind of back to back. So, and then also, I have not looked at the insurance issue too much yet, but when I was talking out in the hallway with people, the lady who commented before me, she was saying how the people that are single, their benefits packages will go down. So I think it would be great to, across the board, to give everybody the same benefits like it has been done before, where everybody is compensated the same amount, and it does not cost the taxpayers any more, whether it is given, however it's given, it's the same amount given. And also I wanted to bring up the library issue that was brought up last week. There was some discussion on what's appropriate and what's not appropriate at the public libraries. And I'm an avid reader. I'm on my 80th book for the year, so I read everything from Civil War stuff, World War II, all the way to kind of smutty romance novels, so I'm kind of a connoisseur of everything. So, but I just feel like when the lady who spoke here last week, she said how she was disgusted that there were things about NAACP and different things on the library website. And my thought is that everybody has a right to be represented. I have friends who are queer, who are in same-sex marriages, whose children are being raised in those family units. And I feel like it is important for those children to see them represented. Children of different races, different backgrounds. And who are we to say that books need to be for white Christians. I think it is for everybody. The library is for everybody, and it's important to have across the board knowledge. And I feel like critical thinking skills are lacking in a lot of places right now, and reading is very important for that. And the more we encourage people to use the libraries and read, the better off we are. And when my kids were little, we went to the library every week, and they picked up a bunch of books, and I never found a book that was bad or not proper, but I went with them. So I feel like it's the parents' responsibility when the kids go to the library to look at what they're reading, and the libraries can have a wide variety of different materials. So thank you.
Thank you. Anybody else for public comment? Seeing nobody come forward and nobody's on the phone, Commissioner Administrator updates. Mr. Gonzalez.
Thank you, Chair. Obviously, it's been busy with benefits and been fielding calls and emails and things of that nature. And I've been pretty transparent, I think, with the process. I mean, some may not agree with that, but if anybody wants to, and I'm speaking to employees in general, they can come to my office and view what we have, and be glad to meet with any of them. I've not answered an email or taken a call. So yeah, I've got an open door policy. So if they want to talk to me, and my door is always open. I've been working with HWL as they hit the ground running at the HAPO Center, working to make upgrades and doing those kind of things. Just really excited about the progress. Working with IS and our sheriff's office, talking about VHF radio upgrades. That in addition to many other things. So keeping busy as always. Thanks.
Thank you. Commissioner Peck.
Is that Derek sitting in the back? It is. I want to take the opportunity to point out I've been working with a constituent in my district in a county donut hole who's got some fairly complex plans for building a home that involves Corps of Engineers shoreline setbacks, actually relocating a road and rebuilding a new road, all at the applicant's expense. Pretty complicated, utility easements, right-of-ways, and I want to acknowledge, for as much as the planning department gets beat up on occasion over issues, they participated in and assisted in arranging a meeting with all the parties, the city, the county, the applicants, contractors, everybody. And it was described to me as from the applicant, as somebody who has decades of experience in federal and state government contracts and contracting, that it was the best, most productive, most professional meeting of multiple jurisdictions that she has ever seen. And she wanted me to make sure that Derek knew how much she appreciated it, and I didn't think there was any better time or place to do that than here on the record. So super job. Thanks for taking that complex issue and making it easy for the applicants. That's it. Thanks.
Commissioner Mullen.
So last week I took the local government's Hanford tour. So I got to tour the facilities out there. Also had the Hub's benefit meeting. This week coming up is a Ben Franklin Transit meeting tomorrow night. Also been had conversations with local residents about situations in the donut hole. And from an outsider looking in, it appears that some people are able to hook up to city water and sewer and others are not. And my question is why there would be selective enforcement on that. I don't understand. If you do it for one person, why can't you do it for the same person in the same situation? And why there's discrepancies as far as why some people are able to hook in and why others are not. So I, as an outsider looking in, I don't understand that. So, sure, come, yeah, please.
So first, I want to make sure I'm understanding the situation. We're down in the donut hole, say in that Wernet area, south of of Argent, north of Court.
Yes.
Those two sections, what we call the Riverview area. I think that's called the Riverview. Anyways, not the point. So you've got a few different things relating to water and sewer connections, okay? So we have no control, say, anything regarding what the city does or
Right.
does not do regarding their water and sewer facilities.
I do understand.
So they're the ones that would make that decision. When a party, down in there, we have our smallest lot's a half acre. A half acre lot, according to the health department, can accommodate a septic, but not a well. That's a decision that is outside of our purview. Again, that's under theirs. So if you've got a half acre lot, you can't create a half acre lot unless you have access to city water. But it's the city that controls whether or not they're going to allow you to access that system. We just have no say on it. So part of our process is to require, when you're going for a half acre lot in that area, generally anywhere, because you're always going to need a public water system or something to serve that property, they have to have prior approval from that water provider. So if they're going to go, say they're going to do all wells and it's 1 acre lots, then the health district will grant them, give them a letter, say, yep, it looks like it'll work. But if they're going to be connected to an actual system at the time of short platting or subdivision, they have to actually have documentation from that agency that's providing the water. So the city, there's a few things too. It's proximity. It's also the cost differentials. So some people may choose not to, even though the water and sewer is in the street. But the long and short is that an individual landowner will need to meet the requirements of the city to determine, and they will decide whether they meet those requirements or conditions to connect.
Yeah. I understand that part. The part I don't understand is when they say that their next door neighbor was able to access the water and sewer, but they are not. And I know it has nothing to do with the county. We have no say in that, but it does raise a question to me is why would they do it for one person and not the next?
Yeah, and my guess is there's some differentials between the two, whether that's property, proposed use. I mean, it's hard to say. The questions that were asked or how they were asked, the city, I mean, there's just because the city wants everybody connecting. Now, there has been a change, and we were just informed of this about a week or two, and this kind of goes off something similar to what Mr. Baumann brought up, is that the city is now requiring that for water and sewer hookup, water hookup, you also have to have sewer hookup, and which is not unusual. But they're also saying that you have to have a minimum density of 3 units per acre. So effectively right now, until we get some things figured out with our codes or something, anything below an acre in the donut holes is not going to be allowed because there's no water provision, unless they can convince the city to waive that requirement for them.
I see.
So that just my understanding. Frankly, I'm not sure if it's actually happened in process or what, but we were just informed of it about a week or two ago.
All right.
That policy was being implemented. So.
All right. Thank you.
Do you have more updates?
Do not.
You don't have any more updates? Veterans meeting was canceled. We're having a lot of cancellations on our veterans meeting. I'm going to look into that. Columbia River Policy Advisory Group meeting, very important meeting that a lot came out of that on the Columbia River, and we're headed on that route. Agenda chair meeting, which is something that Benton County is now going to adopt because of the library board. They didn't even realize what they were voting on, so they are now going to start a agenda meeting so they can go over their agenda prior to the meeting and know what's on the agenda. The hub meeting we had, which was very informative, really did a good job getting all the information out to us. And then I want to report that there's been more accidents up north. We had a potato truck and a van get into an accident. And I want to warn the people that when you see these fully loaded potato trucks, they cannot stop on a dime. Do not pull out in front of them. Take your time. Also had a terrible accident over in Benton County where a carload of young girls were heading to a church event. I'm just asking people, it just seems like, and I've talked to the ambulance drivers, and we've just got an ungodly amount of accidents happening. There's deaths, and just asking everybody to take caution and slow down. Take your time. Those few extra seconds are going to make a difference. So with that, we'll move down to the elected department head business. Is there any elected department heads that want to speak? Come forward.
Good day, Commissioners.
Morning.
I sent each one of you and Mike and copied each one of you commissioners in on the resolution and the comments on it. I just read it this morning, hadn't seen it prior to that time, been in and out of the office this week. So I really want to caution you to look at this. I appreciate the fact that you're going to get some legal counsel that is experts in that, because in my book, I truly believe it's a socialistic move. I really do. I believe that you're taking from one, giving to another. I think that you're distributing it. I think it's the same thing that I believe Obama was trying to do, a distribution of wealth. Now, I know that's a play on words, but if it has any merits at all, please look into that. And I don't believe it's going to save the county any money, because if you look at what the county would pay on a family under the PPO 1000, the county is going to pay over $2,400 their share. Right now, they're only paying $1,500 and some on the medical portion. I think a lot more people would opt into something like that, and I don't think the savings is there. When I look at trying to explain to one of my staff members that has raised a family, that is close to retirement, that is of a high value, and another employee that may be just starting a family, many children, a husband and that, and I tell the one, it appears as though you're of less value because the county is going to put less money in towards you than they're willing to put in towards this other person. That's a hard one for some employees to swallow, and I know I've had several employees in my office speak to me. The majority of them are represented by two different unions. I think that might be a real challenge for the commissioners in the future dealing with the negotiations on the unions. So me personally, I did give all of you kind of a layout of where I'm at personally. I can take it either way, okay? But it actually, when I look at it, it would almost force me into something that would cost the county about $200 or $300 more a month than are currently giving me to get the coverage that probably I can let go elsewhere. It's not a savings to the county. It's a redistribution of wealth. So, and it's a redistribution of the county's taxpayers' money, wealth, not just the individual employees. So please, I thank you for looking into that and considering it.
Matt Beaton, County Auditor. The assessor's comments struck me as odd because that's all we do is redistribute the taxpayers' money. But that's okay. You guys do have a tough decision ahead of you, and I appreciate the hard work that's going into it. My purpose coming forward today obviously had to do with the exit conference. For starters, I really appreciate in the time I've been here, and I know it was since 2018, that we've moved these exit conferences to a public meeting. And it brings attention to kind of the inner workings. The public's not going to be super interested, but the purpose of me stepping forward today is there was a little bit of confusion around that, and I think it's important for the record, and pretty much for the record only, but for you three to understand. For starters, the suspension and disbarment, there was a loose connection of that to the fraud that went on here. That particular check is a process that's part of federal grants spending, and so it isn't really a check. If it had been done properly by the county, it would have been a self-reported contract condition. And so the public works fraud, on the other hand, was local dollars. And so I just want to reassure you that that suspension and disbarment, it wouldn't have been part of that. It's our vendor verification process for the county and for regular spending involves federal and state agencies to verify those vendors. As far as the ARPA goes and the fact that this occurred, and again, this is a reporting and a kind of a process thing, so it's not huge, but it does illustrate something important, and that is that was set up, the setup, tracking, and reporting were exclusively in the commissioner's office as established by the prior administrator. He and his staff were managing it. And unfortunately, the auditor's office had a minimal role. I've never been in favor of the way it was set up. In fact, Mr. Gonzalez can attest to that when he arrived in the spring, I requested that at the minimum, one of our accounting team be included to review and advise directly. Qualified accounting personnel should be involved in the tracking of that just for these reasons. But again, these were just light reporting reasons, but the other purpose is that to stay right up on top of it so that at any point in time, you know how much money you have. But that's important to me that you guys understand that particular finding, unfortunately, was right in your office. And so, yeah.
So let me enter, Mr. Gonzalez, have you given one of the people in the auditor's office that ability to review?
We are now.
Good.
So I've been working with his office to make sure, and want to let the public know we're currently in the transition of how all the ARPA funds are tracked and looking at it, and we're handing that over to the auditor's office. So
I think that'd be well advised. Thank you.
Yeah, thanks.
Anybody else?
I just want to say thank you to the auditor's office for verifying all the vendors. It was stated earlier that there was a company in non-existence, which is true, but that fraud from the past was a well-known company that basically went out of business. In fact, I just seen their mud flaps on a truck yesterday. So, I mean, it was complete fraud and orchestrated in a way that didn't catch the attention that it should have. And I want to thank the auditor's office for double verifying all of our vendors now. Thank you.
Mr. Killian.
Mike Killian, County Clerk. Just a couple things. I concur 100% with Commissioner Peck's statements this morning, with Assessor Rosenau's statements this morning. This will affect more than 59 employees in this county. Their benefits will be drastically cut. There's also a state constitution issue that I emailed to a few of the commissioners, and I don't think I emailed it to Mike, but salary decreases for elected officials cannot happen during our term. So if we're saying VEBA is salary, and it's taxed in our paychecks and it's in our yearly IRS statements, then it would be a violation. But more than that, it would affect many, many employees, and it is a distribution of wealth from one to another. And so I agree that it is socialistic is what we're looking at doing. So those are my 2 cents.
Thank you.
Thank you.
Anybody else?
Thank you, Commissioners, for allowing me to step up and speak again.
It is
I want to
elected.
thank.
This is only for elected officials.
Oh, is it? Okay.
That we have
No,
a
that's
public
okay.
comment period coming up.
Oh.
This is only for elected officials and department heads. Any other elected officials, department heads?
Am I allowed to speak during the session or no?
At the public comment, you can. Okay. So if there's no more elected or department heads, we will move down to administration office business. Mr. Gonzalez?
Thank you, Chair. This is something that we were talking about this past Wednesday's meeting, the purchase of the building at 1310 North Fifth Avenue. Many know it as the Michael Davidson Law Office. So I was asked to look at some adjacent properties, in particular the gas station. So we had Todd Sternfeld look at that. You know, that's going to be upwards in the price range of around $4 million. Plus, you got to think about development costs. We did look across the street. The vacant land is on the market for right around $1.2 million. So that's another thought. We have been trying to get a hold of this whoever owns the, it's not on the MLS. It's, looks like it was used for corrections. I think it's 710 North 4th Avenue. So we've been trying to get a hold of that individual just to see the price point. Haven't been able to get a hold of them. So did a little bit of other research, and thank you to Teresa, our clerk. Just to put this in perspective, what we're paying in leases across the county currently for our various staffs like planning. So we pay $104,618.88 yearly for multiple buildings. So, you know, this could save some costs there if we put some folks into the building. I worked with Todd on, there was some talks of perhaps doing a lease of the Davidson building and waiting to buy it. So these were some numbers that Todd gave me. The Davidson building is 7,236 square feet. In East Pasco area, that's probably going to go for 14 a square foot. So you do the math on that. That's $101,304 monthly, a yearly cost of $1.2 million, and more than likely would be a triple net lease, which means basically you're paying tax, insurance, maintenance on that. So to me, it wouldn't make sense to lease it for what we can essentially buy it for. And again, I do want to let the public know that we did our due diligence. We did an appraisal. It appraised for $1,225,000. What Michael Davidson is offering it for is $1.1 million. I've had Derek, and if Derek can come up, Derek had a chance to look at the property because, you know, he's one of the main folks that would potentially go in there. So obviously he's a planner, so I wanted him to kind of give a layout of the land and his perspective, and he gave me a nice layout of the land in terms of how he could potentially use it.
Now, understand my analysis is basically from the review of, would this work for planning and building? I did do a little, you know, and it's not you can go real deep, and I didn't go there. So, you know, the facility fits. I mean, it would definitely accommodate the planning and building department, you know, and allow for growth to some degree. In fact, Public Works went with me to go look at it when we went over there. Look, because we were looking, well, maybe we can both get out because you know, Public Works pays something like $4,400 a month for the building they're in there at Stearman and Argent. And, you know, we're looking at it, and yes, we could both physically fit in there, but it would be tapped out. There'd no more growth, and it would be in the multiple six figures to get everything set up to accommodate that type of a scenario. So planning, I don't know if you've been in the building at all, but it's split down the middle, or not down the middle, it's about a third, 2/3. So you got the left side, the right side. Left side, planning would fit in there. Might be an idea to knock through that wall. However, that wall is most likely a load-bearing wall, the one that separates them, which would then open up the back area, and maybe you have some back folks. There are some issues. The HVAC system is looks to be each side has a 2-unit, which is good because each unit's not as burdened, so they don't, you know, that can increase the lifetime. But it appears, well, according to the little sticker on there, where, you know, the guys come out to inspect it, that was last done in 2016. I can't say that that's the case. All I know is that that's the last time it was indicated on the doc thing, and I believe they were installed in 2005. So they're getting close to the end of their life. In general, they're about 10 to 15 years old. So those are something that would probably need to be replaced, but not imminently. Then you've got your IT infrastructure. That's got, they're there, the bones are there, but all of that would have to be increased and improved. So is it a good building? It's got good bones. I think that, but it would need, like I said, some $100,000 to $300,000 probably once all said and done, and improvements. Plus you got your moving costs and downtime and various other variables. As far as land, I mean, you know, my experience, if you're able to acquire a structure at below market value, that can be a benefit, but a lot of it will also depend on how the county wants to use that space. Some of the limitations are that, like I said, it would be pretty much full up, so what happens about growth? You know, if we get more employees or we expand services in the county, as it grows, we're going to have to keep increasing some of those dynamics. It may be maxed out at, you know, kind of like the schools. By the time they build them, they're already at capacity. So it's, you know, and then it also becomes a semi-liquid asset in that if there's a need in the future to sell the building, the county does own it. It's a one-time expenditure dollar. So there's that aspect to it, but at the same time, there are some limitations, like I've already discussed. Another curiosity would be to discuss with the school district regarding the north lot, this gravel area that the school district owns, but it's not clear what they're going to be using that for. But so I wish I could say with more confidence, yes, no. I would say that it would work for our needs. I just don't have a broad enough understanding of the county's financial situation to say, you know, could this be done somewhere else, better expenditures. But the building itself would work for us. I think it's an attractive building, close proximity to the courthouse. It would bring us back into that kind of campus setup. At the same time, there's also costs associated with the maintenance and upkeep of the building we're in. But if we can't vacate one of the buildings, you know, that we're already currently leasing completely, there's no cost savings. So, for example, say building and planning moves, but weed board and pest board are still in that building. We're still paying. I mean, you know, it's kind of they're a different entity, but in the end, it's county dollars. So, if we can get some of the other port buildings unoccupied to where we're not, I could see that this would be even more of a potential benefit. But again, you know, just a cold analysis or look at the building, it could be done. As to whether it's a great deal for the county or the best use of expense, I wouldn't speak to that matter. I just don't know the overall budget and all the little nuances that you guys are privy to. That I know my department. And there's a benefit there. I mean, and I don't know how the fact that we own a building would affect my department's outlays of expenditures, how those types of things would work. But so that's just my general analysis. It's, like I said, lots of room in there. Some areas can be subdivided pretty easily. Other ones may require a bit more work. You know, there's a difference between punching a hole between two office walls and a load-bearing wall. So I can answer questions. If you have any specifics, I'll let you know if I have a response or not based on what it is.
Do you think it would be to the public benefit to be closer to the courthouse?
I could see along that idea of the front-facing folks, you know, and again, I don't know all those departments or some. Generally, you want to keep your departments in one place. Sometimes you can, because of the nature of them, have maybe a satellite, and then. But you know, planning and building, folks know where we are. Do I think folks would have any easier time finding it? No, because it's not at the campus. You know, an address is an address. What I mean by but. It's a cleaner building. It looks nicer. I mean, it's a better face for the county facilities, as well as there's more parking, and you could have potentially multiple services out of that building. You know, planning and building would only be on one side of it. The whole other side, we wouldn't have any need. So there was more. It could be multi-departmental. And if you're going with the idea of having the front-facing folks, and again, I don't know which ones, you know, like, so I'm just throwing out people in that, you know, licensing, say, right? They issued license, those types of things. That facility, I think, would be beneficial. because it is an inconvenience for folks to go through security. Proximity to the courthouse would be a little bit more secure than our current location, but it would be less secure for those people that are currently in the courthouse. So it's just this constant pros and cons, tug and pull of, yeah, there's this, but there's also that. So I mean, it would accommodate. It's got plenty of parking. And then I think there'd be a pretty good chance of talking with the city, or I mean, the school district with regard to using that parcel to the north for a lease or something, or potentially acquiring it. Not sure what it is for. I'm sorry, it's not to the north, it's to the east. It's just gravel, and then they got this fenced-in gravel area, but that would require investigation and contact. So it's like, would I make the decision based on us being able to use that gravel? I wouldn't, because it's not a guarantee we'd be able to. So it would need to be a decision based on just that space. But there are other options, or potentialities for a lot of different ways that property could be utilized as far as office space. Anything else?
No, thank you.
Thank you.
Any other questions, commissioners, or?
Are you looking for us to make a move on this
Yes,
today?
sir.
A motion?
So we have the PSA that has been signed by Michael Davidson, and it would just require your 3 signatures, and that is currently here. So I think we'd have to make, and I'll defer, because I'm not a lawyer, I'll defer to Jeff we have to make essentially a motion for the purchase, and it's not necessarily a resolution because it's a PSA, it's a purchase and sale agreement. So we have that document here, Jeff,
Right.
waiting for signature. So I would assume that would make it legal, and without, because it's not necessarily a resolution, it's more of a cut and dry. You sign the document, we become.
That's correct. Yes, the Board of County Administrators would need to make a motion authorizing the county administrator to sign the PSA.
And in this case, Jeff, I have their 3 signatures, which are ready, so they would have to sign it today. And that's just the way we kind of formulated it. The only thing, I guess we could alter that, and then we could alter the document. The signature's already there. I could sign it, or the 3 commissioners can sign it before they leave.
Sure.
If that's the case.
Yes, they could sign it as well.
Okay.
I just note that the item on the agenda has this listed as an update. Says Franklin County Purchase Agreement, parents update underlined. If action was intended today, it would have been appropriate to have that indicated on the agenda and have a resolution to go with it. Technically, I suppose a resolution may not be required, but I think in matters of
On both agendas.
significant purchases like this probably ought to be documented by resolution. Anyway, I just note it's on the agenda as an update. I would hope that somebody is not here because they weren't expecting action.
Oh, it's on the website as an update? It's on the website as an update, both the agendas I have.
Could,
have update on it.
Could we note that as advice for future large purchases and move ahead with, because it doesn't change the action, does it? And I think we've been pretty transparent in terms of, we've discussed it quite often and open.
One question I have, Mike, before we move on is I've asked, we have no account of what we got left in ARPA funds. Nobody knows the answer to that.
We do. So with this purchase, my understanding is we'd have right around $400,000 left in ARPA funds. So.
Okay.
So, and answer your comments regarding the OPMA, the Open Public Meetings Act, would require us to provide sufficient notice to the public of any action items we are taking. So, we want to make sure the public's informed if we're going to take action on something like a PSA. Ideally, we'd have the purchase and sale agreement on on our website as, so the public knows that it's an item we could be taking action on. My understanding is it was on the agenda or posted the last time that we presented. Is that accurate?
Yes, it
We
was.
put the PSA on. So I guess a
And the
member of the
price
public
is
following
same.
along
Yeah, the
would
price
know.
would be the same as a,
But yes, I would say ideally, so we're notifying the public of what we're doing, we would want to put that PSA back on. It sounds like we may have modified it as well. Maybe just the signature block was modified.
actually, no, the signature block is the same.
Okay,
Yeah.
okay. That certainly does raise a concern.
Would it put us in jeopardy if we put it on the agenda for next week?
Potentially. I mean, I do think if there were questions, people had questions about that. With the term update in there, I think anybody that had an inclination of, could have looked at prior agenda items. We're on YouTube. I feel confident that the inquiring mind would want to know, and the media would want to know. I'm an old reporter, so it sort of begs the question of if you see it, you're going to look back and you're going to do a little bit of homework. So I'm confident from a transparency standpoint and the fact that it's been on YouTube and we're talking about it again here in a public forum and it's on YouTube, and I'd be more concerned if we were paying over market value and we didn't do our homework and there wasn't a need, and it was just like, hey, we wanted it. But I think when I weigh all those factors, I feel good. I feel good about telling the public, look, we made this purchase and we did our homework. We got a great value. We're going to, be able to move personnel that's front facing to help the public out into this building. It fits in our campus. I think, Commissioner Pex even said it, he's had his eye on this building for many years. And, I think we're all sort of in concurrence. It would be helpful. So weighing all those factors, I would say let's move forward. We got a lot of work to do to get the building, moving forward and get people in places and really figure out, the best strategy to utilize it.
So the issue here is not whether or not it's a good purchase or a good building or we need it. The issue is whether or not we should be spending more than $1 million of taxpayer money on a contract and not have it listed per the OPMA, Public Meetings Act, as an action item on the agenda. People have a right to look at the agenda in advance and see what is here. Whether or not there's anybody out there that has an interest in this, I don't know. That's not the point. The point is you're spending more than $1 million of public money signing a contract, making a long-term commitment, and it's listed as an update, not as an action item. This should have been a separate agenda item equal to the resolution for the benefits. So is it an administrative objection? Yes. Is it going to land us in litigation if we do it this way? Probably not. But the OPMA is there for a reason. We ought to follow it, barring any clear damage to the county that it will cause. I have talked to a number of employees about the building. Some of them have expressed concerns. I've long thought that it would be a good building for the county. My position hasn't changed. I'm anticipating supporting the purchase, but I also believe that the public has a right to know when we're spending $1 million of their money. They ought to have the opportunity to come in and comment on it, and that happens when you put it on the agenda.
I'm in favor of purchasing the building as well, but I do believe it should not have been listed as an update. It should have been an action item, just for the public has an opportunity to come in and speak on it. That's my opinion.
That sounds good. Respectfully,
Put a resolution with it next week.
Sounds
and let's
good. We'll
get it
do
done.
that, and we'll get it on the agenda. Thank you, guys.
Thank you.
Yep.
Takes us down to public comment.
Hey, Russ Linstetsky, Chief Deputy Treasurer's Office. I wasn't sure what the exact rules were for department heads, so I wasn't sure if I was able to speak earlier. But I just wanted to echo what John and Mike said and go back to the whole discussion that got tabled earlier. I think as a county, and I speak not just for myself, I've had this conversation with a lot of employees, there's something that we need to consider and look at, and that's the difference between equality and equity. This is being said as a move that would provide a lot of equity. As a county that has a conservative value, I don't believe equity is necessarily what we are aiming for. It's equality. And what equality is providing everybody the same level field, and then from there, the person determines where they end up and what they choose. And I believe the new contributions or the new change would this benefit a majority of the employees. I don't know those numbers, but just speaking to about 25, 30, I would say 95% are not in favor of the change. I don't believe this would save the county any money, not from the numbers I've seen. So really the only thing is employees would be forced to shift money from one pocket to another pocket and be forced to benefit that doesn't really benefit them but cost the county the same amount of money. Now there is a lot of conversation to be had, but I just wanted to make sure that at least some of the voices that I've talked to are heard, and including my voice. Thank you.
Thank you. Anybody else for public comment?
Thank you for this opportunity again. I just wanted to conclude my previous comments with an observation. Thank you for providing the opportunity for public comment multiple times in a meeting. The City of Pasco, I've asked multiple times, and that request has obviously not been realized. And that is, at the City of Pasco, you have one opportunity every other week for public comment. So if there's a topic on their agenda that you would like to speak to, they workshop one week and then they have regular council meeting for action the following week. So there's regular action, or there's a workshop where they discuss it, and then the staff makes a presentation to the council members, and then it is opened for public comment, where the plan is to vote 2 minutes after you make your comment. So you have 2 minutes to potentially provide objection, and it's very ineffective. So what the county does with their agenda, providing 2 public comment periods, I think is very helpful, and I wanted to thank you for that.
Anybody else? Public comment?
Thank you, Commissioners, for allowing me to come up and speak again in the correct time frame this time. I just would like to thank Commissioner Peck for his view and opinion on this VEBA contribution payouts changes. I absolutely think the same way he is thinking. It is not fair, and it is not just to all the employees in this courthouse. It would be benefiting a certain demographic while taking away from another demographic. And I just want to make sure that it is really truly looked at and thought about. And I want to also comment on that equity to equality. Those are 2 different things, and that also needs to be looked at. And equality throughout this courthouse, through all these employees that are here dedicated, working to help the public and help this county for everything that they do, is very important to each employee here, that they come to work every single day to work for the county and to work for the public, and to now tell individual employees that they're going to get a lesser allotment amount. They're going to have to now pay a premium and get less in VEBA to the person that insures their family, where they're going to get a more allotment amount, pay less in premiums, and get more to VEBA. It's absolutely unfair. It is completely lopsided, and I just wanted to speak my voice to that. Thank you.
Anybody else for public comment?
Good morning.
Good morning.
I just wanted to briefly address, not the benefits per se, but the comment that Mr. Beaton made with his little shot across the bow to Rosenau about how everything we do is a redistribution of wealth. presumably is referring to wages paid to employees and the services we provide. It's absolutely a free market exercise to compensate somebody for their labor and or their product, and which is what the county government does. Any high school level economics class would teach you that, so I'm not sure why there's confusion there. But on one hand, you have an elected official who's trying to maximize the value of the compensation to his employees to increase productivity and return the taxpayer's investment. And then on the other hand, you have somebody who's disparaging employees and distorting the public perception of what government actually does. And I think it's necessary to address that. Thank you.
Thank you. Anybody else? Public comment.
I would like to address the ARPA situation. I would like to meet with each of you commissioners and you, Mike. There have been numerous times that I have given the list of all items that were approved and or not approved, but proposed to not only the commissioners, but I've given them to Mike. I've given them numerous times to accounting and spoke with them all the time. I take pride in my work, and I want to show you the documentation that I've got. The reason why the portal was not done every single quarter, I had to get in there every single quarter. Excuse me. I had to get in there every single quarter. But the reason is that the funds were so fluid. There are so many departments, so many projects, and what I was trying to do is I was trying to figure out what should be under the 10 million for the revenue loss, those items that should add up to that, and then how many items, and albeit I wanted to put as few as possible under the other 8.5 million. And so I did it to the best of my ability to make sure that we had as much down to the penny going into the 8.5 million as possible, but as few items, because there's a lot of reporting in the portal to do, and no one has a clue how much work has gone into this and the hours that have gone into this. And the thing is until February, for 1.5 years, I have done it on top of my full-time job. And so I would like to sit down with each one of you, because this was totally taken out of text as far as the work that's involved. And I felt good, and I was aware of those two things that I knew we would get dinged for. But there's a reason for it. I was trying to do the good thing for the county, no different than being given a federal fund, and no templates, contracts, nothing. I had to seek out everything I did, and I had to get a hold of other counties and such. So again, I think that no questions were asked of me. I don't feel it's a good idea to be transferring it over. They have had the finance part of it all the time. I get a report from One Solution on what was pulled out of the 119 fund, 87 pages that I just went through again. So again, this is something that I haven't appreciated, because I do a good job. And I do over and above. So I would like to talk with each one of you and show you the work. I think it's important.
Thank you. Anybody else for public comment?
Kathy Sant, Franklin County. Thank you for the clarification on the ARPA. That was interesting. I also agree with all the comments that have been made about the insurance, and I just want to say that I'm glad you're taking some time to look into it and maybe decide that there's a better way to do the compensation than what's going through right now. And I also want to agree with Steve that it's nice that there's 2 comment periods, but again, at least city allows the comment period to be before they vote. So it would be before they discuss and before they have the action items on the list. So I would really appreciate if one of the comment periods was before the action items. So thank you so much.
George Dockstetter, Self Landing Road. 2 comments. One, the Davidson building's been discounted for 8 damn years, and 1.1 doesn't sound like much of a discount to me. Ever since he got married and moved out of town, he's been trying to get rid of that piece of crap and can't do it. He's offered it to everybody, attorneys and whatnot. I think you're getting a raw deal. And I think we could spend our money. It's a good building. It's probably worth that price, but we're not the ones that have to buy. He's the one that has to sell. So my second comment, as far as all this insurance garbage that's been going on and discussed for years and years, when somebody takes a job and you're offered a benefits package and you don't take the benefits, I've never seen the employer write a check and say, here's the money for not taking it. You're offered a package, and when the package is there, you take it. That's part of your compensation. When I offer benefits to the people that work for me, they don't take it, I don't write them a check. Thank you.
Thank you. Is there anybody else for public comment? Mr. Gonzalez, do we have any executive sessions?
No, sir.
So with that, if there's no other business for the good of the county, this meeting is adjourned.